Of course, we have another question. So let's put 2 minutes on the clock, making sure as well that you are as far to the right on the slider as possible to make sure you're on time. And your time starts now. All right, 2 minutes is up, and let's get to some answers here. And so great to see a couple of answers coming through. And yes, everyone looking at this is saying, yeah, it's probably going to be migraine with aura. So very, very well done. And of course, we do have here benign intracranial hypertension. If you're starting to get symptoms like this, I do fear you're leaving the benign component of that diagnosis, but something you could potentially consider. I don't know how it would go in terms of getting some points here, though. And intracranial lesions, yeah, true. Definitely would be something to be taken into consideration here. Now, of course, the migraine with aura is going to be that 2-mark answer here. And tied into that, which are separate diagnoses, would be things like retinal migraine or ocular migraine. Retinal migraine is the more unilateral form. Ocular can be both eyes as well. Migraine being less specific. Remember, we want to be specific and concise. You're going to get 1 mark, but you're going to be missing out on that 2-mark option there. Occipital lobe epilepsy can present similarly to this as well, and so it would be something that if standard treatments are ineffective or there's failure to response, you would have to be considering. And of course, transient ischemic attack. I have seen a patient who presented very similar to this that turned out she actually had a patent foramen ovale and subsequently needed to have that managed because she was actually having TIAs. So try and keep that kind of broad mindset. And yes, I will fully credit intracranial lesions would definitely get you a mark in here as well. So well done. Of course, let's get to the next question. We'll put 2 minutes on the clock and your time starts now. All right, time is up and let's get to the answers. So we do have lots of options here, and one of the things I always want to highlight with these questions here, anytime you see migraine and the oral contraceptive pill, one of the options is always going to be cease the oral contraceptive pill. They want to kind of highlight that you've actually got that marked there. Of course, using an antiemetic given the patient's complaining of nausea would be appropriate, and the go-to for migraines, usually metoclopramide, so again, be high marks there. Now, tying in then would be our kind of NSAID or anti-inflammatory medications, so aspirin, ibuprofen. They would be grouped, so you'd only get marks for one, not both. Paracetamol, simple analgesia, fantastic, but they have specifically mentioned here that previous simple pain relief has been ineffective, and this means we can actually move on to our triptans as well. And as long as you're giving a sensible option for a triptan, you're going to get those marks there. Now, I will highlight here that if there is nausea involved, sumatriptan's a fantastic option because you can give it orally or you can give it intranasally, as has been pointed out rather successfully there by John Travolta. Great to have you here tonight. Dance the night away. And so it would be something that I would be considering for this patient in particular. I will just pop into here. You have specified an antiemetic with an example. I would probably say, instead of saying antiemetic with an example, or as you have here, NSAIDs, e.g. diclofenac, I would actually just take out the NSAIDs, e.g., and just specify diclofenac. Again, these are clinicians that are marking the exam, and so they do have that understanding of, well, you've acknowledged that kind of branch by putting that answer, and so you would get that mark. Hope that makes sense. All right, let's move on to the next question then. We'll put 2 minutes on the clock, and your time starts now. All right, so time is up and let's have a look at what the answers coming through are. Now, you'll actually see this kind of stuff all the time in the exam where the third question seems to depart a little bit, but I want to highlight here, this has actually already given you that hint there. I thought she was on the oral contraceptive pill. This should be flagging, oh, did I forget to do something? And this is where you can actually make marks by going back and saying, oh, that's right, there was the pharmacology thing I could add into there, cease the oral contraceptive pill. So just a little tip there. Of course, this is using the UK Met guidelines where we have lots of options here. Many of them have been specified in your answer, so very well done. So we have the copper intrauterine device, the levonorgestrel intrauterine device, the Implanon subcutaneous device, depot medroxyprogesterone, progesterone-only pill, and you would not get marks for, again, using the COCP, given obviously we have migraine with aura here, or the NuvaRing vaginal ring device. And looking into this a bit further, there is conflicting evidence, well, there's really a lack of evidence to say the NuvaRing isn't a fantastic option, but after there were some cases with bad outcomes for patients, the manufacturer has actually stated that it should not be used in patients with migraine with aura. So that tends to end all debate on that matter. Now, if I want to get really, really nitpicky on the answer there, I will say avoid abbreviations. So you've got IUD and LNG as well. In the exam, make sure you do spell it out. And I appreciate you're probably just putting down the abbreviations to get the answers in tonight. I would say practice, practice, practice. Make every time you practice answering these questions, try to do it as if you would do it on the exam day. And I know it sounds stupid, but it'll stop you on the day from making silly mistakes and using abbreviations where even if your answer is 100% correct, they might be subtracting marks or not giving you marks rather because you've used that abbreviation there. So just save yourself the heartache, save yourself the pain, practice as if it's the actual thing.